Hi, everyone, and welcome to the Veterinary Profession Podcast, the show where we'll dive into the world of veterinary medicines, exploring different career paths, specializations, and experience from professionals across the world. I'm Susan Aryal, Committee Coordinator of IVSA Global, and I'll be your host along with Akriti. Today, we have a special guest, Dr. Maryline, a Lebanese veterinary doctor with a fascinating journey in equine medicines and surgery. After earning her degree in general veterinary medicines from Lebanese University, she took a bold step in her career by moving to France, where she specialized in equine general medicine, surgery, locomotor pathology, and diagnostic imaging in Lyon and Toulouse. Now, Dr. Malin works as a referral practitioner, collaborating with veterinarians across Lebanon, France, and Nigeria, handling a complex cases in general medicine and equine locomotor pathology. In this episode, we'll discuss her experience studying and while working internationally, the challenges and reward of veterinary medicine, and her advice for aspiring veterinarians who want to explore the specialized field in equine veterinary medicines. So let's go into it. Dr. Madeline, welcome to Veterinary Profession Podcast.
Hello, thank you for having me.
Hi, ma'am. I'm Akriti, the project manager of FirstCovi, and I'll be proceeding with the questions. My
Yes,
first question would be, ma'am, what really inspired you to pursue a career in veterinary medicine?
it is something that I've always wanted to do when I was a kid. It was thanks to my grandfather once he took me to see horses at a stables next to our home. So I was like 5 years old. And since then, I was fascinated with horses. I love animals. My family loves animals. So we have a, a large variety of animals where I live. We had cows, dogs, cats, pigs, lots of poultry. So I grew up in it and I loved animals since I was a kid. And it's everything I've wanted to do since I was 5 years old, especially for horses.
That's so great to hear, ma'am. And how was your experience studying at Lebanese University?
It was challenging, it was hard, it was long. We have 6 years of general medicine in Lebanon. It was very challenging because the university was new. So our teachers were also new, the courses are new. So we had to do a lot of practice work on our own, read on our own, do our own research in order to improve. But overall, it was great. I had great friends who inspired me a lot. I had great teachers who also inspired me. And studying veterinary medicine worldwide is never easy. So I bet it's challenging in every country.
Yes,
Mhm.
ma'am, you are an inspiration. But what really motivated your decision to specialize in equine general medicine, the surgery, and the locomotor pathology?
Um, Equine medicine was always a choice because after I was introduced to horses, I started horseback riding. So it was a sport that I used to do my whole childhood, and I love horses, and even if I loved all other animals as well. I had cats and I had dogs in my home, so but horses were special, and I was really interested by them. This is what inspired my specialization. Plus, in Lebanon, we don't have specialized vets who only are trained in working with horses. So, if I wanted to pursue equine medicine, I had to travel abroad and seek other universities in order to be able to study equine medicine or surgery. Locomotor pathology came afterwards during my many travels in order to do my externships worldwide in Holland and in Belgium. And I liked to see the equine locomotor system, to study it. It's very complex and it's very important also for the horses. I had the chance to work with sports horses in Belgium and Holland, and this is what motivated it mostly. So this is why I chose locomotor pathology and diagnostic imaging over other specializations.
Mm. So thank you for that answer, ma'am. So on the basis of your answer, I think like finding out the college where you could study equine general medicines was one of the challenges. So considering
Yes.
what were the other biggest challenges that you faced while transitioning from the general veterinary medicines to your specialization?
Um, a lot of challenges when, especially in equine medicine, when they try to find interns or other young vets in order to be integrated in the system, be accepted in a school, be accepted in internships and residencies. Your background, your initial studies are very important. So for someone like me who came from a small country with a new university who is not known, doesn't have much accreditations worldwide, this was the biggest challenge. Me coming from a small background, not known university, uh, this was my first challenge. The second challenge was the different culture. Me coming from a modest Arabic country, where going to a European country and alone. I was alone. I traveled alone. It was the first time I leave my country alone to live for a year, 2 years now. Now, today, it's been 6 years since I left my home. So the new, the change, the change I had, it was a big challenge. Um, One of the other challenges were also me being away from my family.
Mm.
When I left, it's a challenge that is personalized to me, because when I left Lebanon, there was a crisis be beginning at my country. So I was away from my family. They were living the crisis. I was living in a nice country, doing what I love, doing a specialization, studying, working with horses, meeting new people. So this was also a challenge. But other challenges also I faced was the difference in the level of knowledge. I studied in Lebanon, and my colleagues, my co-interns, they studied in Spain, in France, in Switzerland. So they had a higher level than I did at the beginning. So this scared me the most, and this is what motivated me to persevere and to work harder than anyone else. And this is what I did, and I succeeded. So these are the three main challenges I think anyone could face: the difference in the levels of university, changing countries, being away from your family, being alone.
Yeah,
That's
thank you
it.
for that answer, ma'am. So, we as an student, like when we are trying to figure out where to do our further study, these are like obviously the basis challenges that we are facing, and we are like really great of you that you were able to solve this challenge and be in the positions where you are today. So, moving on to the next question, Akriti.
Thank you.
Ma'am, as you said that you have faced so many challenges, and apart from that, here you are doing what you love the most. What do you think are the skills which are important for veterinarians who wants to specialize in equine medicine and the surgery?
Um, the thing that is the most important and that will facilitate your lives later on is to actually have a small background with horses beforehand. So, like myself, and you will see it in all the equine vets, practically all the equine vets. They either had horses in their lives, or they worked in a stable, or they did horseback riding, or they grew up with horses. This is important because understanding horses, they are a huge species. It's like me saying I would like to specialize in elephants.
Mm.
It's mind blowing. It's different. It's you have to know the animal in order to specialize in it. So horses are a bit like that. They are precious. They are, so this is a skill that is a must, but it doesn't mean that if you don't have it, it doesn't mean that you cannot go and specialize in horses. It can be learned. So this skill is, I think, is interesting and is important. Another skill is perseverance. You never have to give up. You can't give up, because if you give up, it's over. The equine field is very strict, is very hard, has long working hours, very small resting hours. Another skill should be, well, perseverance, hardworking, tough emotionally. This is very important. Not just physically. I'm not big myself. I'm a small person, and but you have to be tough emotionally, because a lot of emotions are involved. Whether it's because your superiors are yelling at you, or the residents, they expect so many investment from you. All of those, they can affect you negatively, and you have to persevere, you have to work hard, and you have to be tough, or stay tough, because we are
Thank
all already tough, but we have to stay tough and try to stay tough.
Thank you so much for answering that, ma'am. With all those skill, when there is a horse in front of you and you have to, diagnose it, how do you approach it? What is your approach towards locomotor pathology and the diagnostic imaging in the horses?
The first thing we should do, whether it was a consultation, medical consultation, or an orthopedic or locomotor consultation, is to look at the horse from a distance. Just look at it. How he's standing, how is he reacting? Is he stressed? Is he not stressed? And then afterwards, approach him slowly. Not go straight forward and you want to see what's wrong with him. No, you have to take it slow. You have to be calm, because it's impression. It's very impressive, because sometimes they reflect your inner state. If you're anxious, they are anxious. If you're calm, they are calm. Not always, but sometimes. uh, so you just look at it from a distance, and then you approach. You look at the symmetry of the horse. You see if there's an abnormality, myopenia, or amyotrophy. If there's swollen joints, swollen skin, any abnormality. You can see him walking a little bit. You can see the walk, if he's lame, if he's not lame. So observation is very important while working with horses, and working on the symmetry is very important in locomotor pathology.
Thank you so much for answering that, ma'am.
So
Thank you.
over here we discussed about your background and educations and career journey and specializations. So we also wanted to know about your current practice and professional experience. So just to move with that questions, what does your typical workday look like as a referral practitioners?
My typical workday, when I wake up, I take my coffee, I look at my mails. I see if someone had contacted me, or if I have news from, I don't know, a laboratory, or for analyzing results. I check my messages, because usually the vets or the owners contact me directly on my phone, on my WhatsApp number. And I see if there's any new information about the cases that I'm following, and if there's any new cases at all. And then I schedule my meeting during the day, if I have to meet with a vet or with the owner through Skype or through a phone call, because from Lebanon and France, it's different than Nigeria as well. Nigeria is very recent, so I would not know how it's going to be. It's really new, and it's gonna be happening soon. But from Lebanon, usually while working in France, ambulatory service, or working with a vet colleague. I'm also always available on my phone, and that's mainly it. And sometimes I schedule flights to Lebanon to see my clients. I think this is good, and they like for me to do that, because even if I'm working with vets in Lebanon, they appreciate me coming once in a while and checking the horses, checking the evolution of my cases, how the horse is doing, if we need to change anything or not, or if the vet can't or don't know how to do something, and when I'm here, we do it together. So that way, I also teach the vets in Lebanon how to do things. And this is practically it. So I manage online, and I put my meetings, and sometimes I travel.
Seems like technology is
That's
helping you
wonderful.
a lot. And also, like, it's really
It is.
fascinating to see that you are able to manage your time and time differences and also the communications between these three nations. By the way, when we are talking about the cases, what are the some of the most
Yes.
interesting or the challenges cases that you have worked on and like that were really fascinating for you?
Interesting cases. Um, in each country, I have different cases. It's never the same case. It's challenging, even in the same country, in two different, from the north to the south, the cases vary. So uh, I I don't know how to answer this exactly, because I really have a variety of cases. But what's most common, I think, is the problems that come from limb deformities. And whether it's in France, in Nigeria, or in Lebanon, it's the same problems, and I am fascinated by that. I've written an article about limb deformities and how to manage them in the field in foals, and I'm very happy I did that because the effect of limb deformities on the biomechanics of the horse is fascinating, is very interesting. It can cause lameness and consequences on the locomotion of the horse that are simply just rectified by a simple orthopedic showing, or a farrier that is willing to work with you and to create this cool and innovating, for example, orthopedic showing that is only for this horse because he has this type of foot or this type of deformity. And I've treated a lot of those in France and a lot in Lebanon. So my most fascinating cases is about hoofs and distal limb deformities. I love that.
And ma'am, what role does advanced imaging it plays in diagnosing equine locomotor issues?
Ah, very important role. It's very important because even even the simplest machines, X-rays, can give us a lot of information. And nowadays we are uh, creating, no, but we are coming up with a new positioning of the feet, or now there's a novel like a novel imaging technique or positioning of the head or the foot, or in order to maybe more localize the lesion or to see better what's inside. X-rays are, or diagnostic imaging, they are the gold standard if you want, in order to diagnose the locomotor pathologies, whether it's osteoarticular or musculotendinous. We cannot diagnose it without those methods. It's important, and it's also important to be well to practice well reading normal images in order to know how to detect abnormalities on those images, especially in ultrasonography. It takes a lot of time, a lot of studying, and lots of practice. So it's important also to give a lot of our time to practice those readings and how to do ultrasonography on the musculoskeletal system of the horse. if you would like to become better at diagnosing pathology, locomotor pathology.
That sounds great. Thank you so much, ma'am. Coming back to your veterinary profession, because it is really inspiring, and the industry inside, how does veterinary practice, it differs in Lebanon, France, and Nigeria?
In Lebanon, it's very challenging and hard because owners, they are used to so many years trying to solve their horses' problems by their own, because for many years there was no veterinary doctor who is specialized in equine medicine. So they find it really hard to trust the vet. When they call you, it's sometimes too late. So even when you give them advice, it's very hard for them to take it, because they've been, for example, on nutrition. It's the biggest problem in Lebanon. They only give concentrates for horses. Can you imagine? So the horse is a herbivore. Now he's only eating grains. It's very bad. And they cannot change this habit because they are not used to it. They are not convinced that the horse needs to eat grass, only grass. He doesn't need concentrates, for example. This is one challenge. The second challenge is economical challenge. And this problem also exists in France. And I'm guessing it exists everywhere. Equine industry is, I have 2 or 3, if you want, points that have in common: economy, trusting the vet, and how do I put it in this in words? Let's keep it to trusting the vet. Okay, so economics, financial, and trusting the vet. And these, it's a very hard industry. Sometimes the horses cost a lot of money and the people don't want to pay. And sometimes the horse doesn't even cost anything and the owner wants to do everything for this horse. I've saw this problem in Lebanon. I've saw it in Lyon. I've seen it in Toulouse. So the industry is different, but is on some levels, it is the same worldwide.
Thank you for the answer, ma'am. So within like these questions, we're able to discuss about the challenges that we have within like equine practice. And but I personally, when I'm working with IVSA, I know a lot of people who are really looking forward for opportunity to work in an international platform. So what piece of advice would you like to give, especially for young veterinarians and also the students who are thinking about like working in an international platform?
What I say is, my advice is to never give up. This is the first thing. Never give up. Always try. Work on yourself. Work on your knowledge. Study. Do research. Read articles. The third advice is, when you want to go abroad, before you decide to go and work directly, because sometimes we can't, go and do internships or externships. Go. Send an email to the structure that you would like to pursue your career in. Send an email saying, I would like to come for an externship for 2 weeks to learn in your amazing facility, etc., etc. You will go and you will introduce yourself. Those people will know how hard you work. You will work. They will know your strong features and your weak features. This is what happened to me. I went to Belgium and I did an internship in De Moret. It's a referral clinic. It's a big clinic. I went the first time for 1 week. Maybe I slept 7 hours the whole week. Maybe. I worked hard. The second year, I went for 2 weeks. And afterwards, those people started to know me, started to know how hard I worked. So they were really appreciated. they appreciated my work. And when I went to Lyon, I went for 2 months internship.
Hmm.
Before the end of my those 2 months of externship, sorry, they gave me a position of an internship at their facility. They told me, if you are interested, the place is yours. It was not in my intention at first. I went only for 2 months. So this is my advice that I give you. Always seek, try to introduce yourself first. Go do small externships, and then you will work your way around it. You never give up. You do research. You try to ask about the positions. You show that you are interested. You show that you work hard. You always arrive on time. I don't know, you always follow the rules of the facility. I've seen a lot of international students when I was in Lyon for a summer school. It was called the externship. It was called summer school. I had a lot of international students that sometimes they come, sometimes they don't come. They were never present at the rounds in the morning. This attitude does not interest anyone, especially in the international community, and especially in the equine industry. The equine industry is hard, is very selective. It's it's tough. You have to show that you can be resilient and you can be better than the rest.
Hmm.
This is my advice.
Okay,
So
so
discipline and punctuality. That.
Exactly. Discipline and punctuality.
uh,
Thank you so much, ma'am.
My pleasure.
so thank you for the first half of the veterinary profession podcast. We still have few more questions, so just stay tuned with us so that we could move forward with the second episode of veterinary profession podcast. Uh, just follow upcoming videos so that you could see the second part of the veterinary profession podcast, where we'll be discussing more with Dr. Maryline the follow-up questions.